So you're so welcome. And um, yeah, okay. I'm inviting to see you soon. So for today, yeah, long time no see. Um, about your healing process. Actually, I know knowing this from my nurses, but just first with the few sentences, I would like to hear from you. How is all going on, and how was the process?
Thank you, Dr. Okay, uh, just to introduce myself, I am CJ,
Mm-hmm.
HRDC, and of course, I come from Britain, so London is my hometown, and I spend most of my time in Coventry. So I've been in a transgender journey for pretty much a lifetime, and been on HRT for a long time. So I decided to plan my gender affirmation surgeries, and one of them FFS, and then we wanted a surgeon who was openly supporting transgender and community, and we wanted to promote and bring such a surgeon into the community. So one of the friends suggested that, of course, your clinic has been uh, really forward in the way things have been done, especially in the area of research work, in the area of openly supporting and writing blogs. And we decided, yes, this is the kind of surgeon we would like to work with. And that's when I reached out to, of course, your assistants and the nurses, and they have been quite instrumental in making sure that the right kind of preparations are done even before I could start, and the tickets could be booked and the dates could be planned as well. So it was a wonderful journey right from the start till this point in time. Of course, I was there on the first week of April, and we did had a good planning for the surgery ahead of the surgery, and we took time to get acclimatized and accustomed to the environment, went and around and had a nice time in Istanbul. And after that, we went for the surgery in one of the best clinics, and everyone, including anesthetists, uh, the day after the night care, and every single one of them in the hospital were very supportive of me, and they worked with a lot of respect and dignity towards transgender people, and that's something we should definitely mention. And thanks to every single one of them who worked with me on during that difficult time. And after that, I remember coming back to hotel, and you have been with me, making sure that I'm safely back in the hotel. So really appreciate surgeon taking so much care. That the surgery itself is a long surgery. It's not easy to come back to the hospital next day and take up the patient and making sure the patient is safely back in the hotel. So that's quite a lot of responsibilities, and you have done great. And after that, we had the first phase of recovery, which was based in the hotel, and the nurses were always in touch, and they were monitoring my pulse, and I was sharing them the data pretty much almost 24/7. They were very supportive in the nights and days, and first few weeks they were helping me out, almost pretty much visiting me every single day. So that was really a great deal of after surgery care, which I don't get to see in most of the surgeons and the histories which I get to see from other parts of the world, but really appreciate it. And after that, we came to the second part of the surgery recovery, which is more about the social and emotional part. So I went around with the nurses, went all around Istanbul, and kind of get integrated to my new looks into myself, as well as integrating the society. I really appreciate that. That really helped me out when I came back to Britain, and then I had to travel all around the world in the corporate where I worked for, and be there in different conferences and places. That initial lift and initial confidence becomes much more important to a transgender executive and when you work for corporates, and that helps the professional life and the social life. So really appreciate your forward thinking and your way of planning there. So that's something really nice. And the third phase was about going back to Britain and taking care of myself. You gave me clear instructions. Nurses are still checking with me every single day, so I really appreciate what they're doing for me. So I really appreciate every single piece of help, and without that, the recovery would not have been so easy for me, and it would have, the pathway would not have been so simple and easy to cross. I really appreciate that, and pretty much I'm now not even in Britain. I'm in Spain now. I'm enjoying the sea and the sun for a week, and of course it's an official visit from the company. So really appreciate whatever has been done and the way things have been taken care of. Otherwise, such a short span of time traveling across and still being confident, going to a professional place where we've got global leaders in the industry, working with them and meeting them and saying hi, hello, talking to them. And then going to the beach and coming back, that level of confidence is, I don't see that any other way possible other than the way you took care of your transgender patients. So I really appreciate whatever you've done there. That's all about my journey, Dr. Emma. Okay, I know you are a busy person. How was your day and how are you doing?
Thank you so much for your all kind words and your existence. Thank you so much. It was really proud to me, actually, to be part of, to be a guide of that journey, to be surgeon of that journey. So you are always welcome. And, we are still going to more surgeries and trying to be part of that trans community to help any other part of the life, not only surgery, because we are doing this proudly, as you know. So still improving the FFS facility in our city, to making new contacts about this, because yeah, every corner of the world, this is a reality. There's trans people, trans community, and society tries to push them into their own corners, but it's not being like this. So proudly I say, I would like to be part of this, and I will try to do my best in every part of it, not just the surgery, as you know that as a aftercare and every part of that, and health, because it's not just doing surgery and that's it. The pre-surgical preparations and doing surgery, aftercare, and aftercare, psychologically you change your face shape and you broke the cage and you are being like a free bird after of it. So getting and meeting yourself back. For every part of it, I am setting up my team to be part of it. We're saying this proudly. And also, about the social part of it, actually, I'll try to have solutions, because, in every feminization patient, it's not just being facial feminization only now, it's being body feminization, facial feminization, voice feminization,